Hi, and welcome to Gulf Coast Wellness. I'm Dr. Peter Shark. And if you've been watching the news at all in the last couple of weeks, you've seen that there's a ton of new CDC guidance. So I wanted to talk about how we're responding because some of our procedures are changing, finally. Number one exciting change is you are now permitted to open and close doors, including the front door, all by yourself. You don't even need me there. The studies are really clear that surfaces are not a big risk with COVID transmission. So we can go back to opening and closing doors. About a year ago, there was some pretty scary stuff coming out in the news about how long COVID hung around on surfaces, but turns out transmission's really not a risk. So it's perfectly safe to open and close the doors with your own hands. So that's exciting. Exciting change number two, this is the big one. Waiting room is open, kinda. So let me first say that you don't have to use the waiting room if you don't want to. Totally optional. You're not required to wait inside. If you want to continue to wait in your car like you have been doing, if you want to wait on the porch, those are perfectly fine alternatives if that makes you more comfortable. If you do want to wait in the car or on the porch, you're just going to text me just like you've been doing this whole time. Let me know that you're here and that you're waiting wherever you're waiting. That way I know to look for you. If you want to come in and wait in the waiting room, first we ask that you only come in 10 minutes early max, 10 minutes or less before your appointment. The reason is there are only 2 chairs in the waiting room. We got one chair on each side with a HEPA filter kind of in between the two. I think it's a very safe setup. Okay, so you can come in, you can sit in one of those chairs, but if you come more than 10 minutes early, somebody whose appointment is coming up in the next 10 minutes might not have a place to sit. So we just ask that you wait and come in within 10 minutes of your appointment start time. You don't have to text and let me know you're here if you're going to go in the waiting room. Second thing is you still need to wear a mask in the waiting room. So please just wear a mask. Keeps everybody the most comfortable and safe. We ask that you don't eat and drink in the waiting room so that you can keep your mask on. So if you have a snack or a drink or something, please wait till you get to your treatment room where you've got a private space to do that in. And we do ask that you still only the patient comes in. So if you have a friend or family member with you, unless you need them to help you walk or something like that, if you could only the patient come in. Again, because we only have 2 chairs, there's not a lot of space. The waiting room's still not really set up how it used to be for a lot of people to sit in it at once. So we just got the 2 little chairs. So please, if we could only have the patient come in still, we're going to keep that in place for now. I'll let you know if it changes. The number one thing that hasn't changed in the office is we are still requiring masks. And I know that with the most recent CDC info, there's going to be some confusion on that. So let me just explain why we're doing that. As a medical clinic, we practice something called universal precautions. And to break that down most simply, it means that I am supposed to assume that every patient I interact with has a contagious disease. It really has all the contagious diseases. So, if we're going to assume that you've got COVID, one of the most worrisome contagious diseases out there right now, I'm definitely going to want you to have a mask on. So, universal precautions say that we should continue masking, and I will continue masking as part of universal precautions. It's the same reason I use alcohol before the points. Chances that I'm going to give you an infection from an acupuncture needle, almost zero, but it's universal precautions, right? There are a lot of things we do in medical clinics that probably aren't necessary, but they keep people safe, so we continue to do them. So I hope you're excited about these changes. I definitely am. Let's enjoy this first step back towards normal. Let's enjoy having an air-conditioned waiting room in a hot summer. Let's keep each other safe. Be well.